Yeah, they're nice people.
Well, you can tell you got a little. Yeah, she is. Yeah. So you started taking care of your parents, like how many years ago?
It's been gradual. My dad died, it'll be 2 years ago in October. Probably the 2 years before he died, we're getting more and more active.
Right.
Where I needed to be more and more involved.
Right. So as you look back on the time that you've taken care of your parents, and you were talking to an adult daughter that said, what can you tell me? What surprises can you let me know?
They're all surprises. You can't see them coming. And I think to get a plan before things get crazy, when you start to see that they're aging, find out what you need to do and when you need to do it.
Okay.
So that you've got a checklist and you feel more comfortable as you go, and it also helps you figure out how to talk to them and to see what they want.
Okay. So when you say a plan, do you have a specific thing that you did that you said, this really helped me?
Yeah, I came to see you. I had no idea. I knew I needed to be doing something. I didn't know what I needed to do.
All right.
And I really felt like I was floundering. And when I left you had given me a checklist of these are things that absolutely have to happen now. These are things that as you get to, it's okay.
Yeah.
And that was probably about over a year before my dad died, and it was a really, really good thing because I can't imagine having to deal with that at the time that you're dealing with grief plus trying to take care of my mother.
Right. So you have a plan. Now your mom has a memory impairment.
Yes, putting it mildly.
Okay,
yeah.
All right. So when you think about moving her from home to a community, which is what you did, which was really a good thing for you to have done, does anything stick in your mind as to that was really challenging or...
It was really challenging because my dad had just passed away and my mother could not be alone, and so I had 24-hour care coming in for her, but that's very expensive and very stressful because she didn't like anybody in her home, and you were always getting different people, so I needed to get her place someplace safe, and you helped with that because my dad died on a Sunday, and by that afternoon I had a list of 4 places to go and see. Within 2 weeks, we had my mom in a really great place.
Yeah.
And it's if I hadn't had you, if I hadn't had all of the legal stuff done before then, it would have been a nightmare.
Yeah, it's something like we've been called coach, like a healthcare coach, or an aging consultant, or a guide. I would tell you that you really took to the advice well. We gave you suggestions, and you did everything that was suggested of you, which was really hard. And I think when you were at home with your mom and her memory impairment and the not knowing who the people were and get out of here and I don't want these people in my house, that you really had to act quickly because it wasn't working. There was constant stress and tension.
It was terrible. It was terrible. It was not good for her. It wasn't safe for her. And it was very difficult for me. I live an hour away. And just trying to make sure she was taken care of and that things were going okay, and dealing with the grief of losing my father at the same time.
Oh, it was almost impossible for you to grieve at the same time help your mother.
If I hadn't had some of the legal things done, if I hadn't had some conversations with them to know what they wanted, it would have been impossible. It would have been just a horrible situation. You said you have to have a plan. Get a plan, and some things you don't have to do right away. There were some things I didn't discuss with my parents because I knew they weren't ready for the discussion, or it would be too much of a loss of their independence.
Right.
I would hire a housekeeper, they would fire a housekeeper. I would, it was that kind of, but those things aren't as important as getting some of your legal things. I didn't know financially what it was going to take care of my mother, and you helped me with that. To figure out that we were doing okay and she would be okay.
Yeah. You took your time gathering the information.
Oh yeah, you can't do it in a couple of weeks, and you can't do it when you're under crisis mode. I can't even imagine.
Yeah. Now, did your dad have his mind? Was he alert? Or?
He did. He was very stubborn, and because I lived an hour away, I think he tried to shield me from knowing exactly what was going on and how bad my mom was getting. I was doing all of their cooking for probably 8 months before my dad passed. Because my mother couldn't anymore and my dad was legally blind. But he would cover up for my mom. He would,
Yeah.
because he was adamant that he wasn't going to leave his home.
Yeah.
And so part of it I knew, and if the house wasn't as clean as I wanted it to be, or it was more important to me that they had their dignity, the safety issues were critical.
Okay.
No driving a car.
Okay.
And all of those things had to be worked into. You can't just go in and do it all in one day.
Yeah,
it doesn't work.
yeah. It doesn't work. You have to
No.
really kind of be deliberate,
Yes.
and then prioritize the
Yes.
things.
Yes.
Prioritize it.
And that's what you helped me do. It was, this needs to happen right now. This can
Yeah.
take some time, and you can work through it.
Yeah, yeah. And the diligence of staying in a relationship with them
Absolutely.
and you did that even though it's an hour away. It might as well have been a
Absolutely.
plane ride away, because you had to take
Yes.
the time to go
Yes.
down there.
Yes.
Uh-huh.
And, trying to give them what they want, but still keep them safe and whole and financially whole. It's a challenge, and you just having guidelines and a plan. You have to have a plan.
Yeah.
And
yeah.
it's better to make the plan when everybody's healthy and you can sit down and talk about it.
Right. So so your mom's in a community now.
She is. She's in a memory
And
care.
when I think about your mom, or the last time I saw her, she was at the end. She's kind of
She
at the
is.
end,
She is. She's 93.
93.
Yeah.
And would you say kind of still a little resistant to?
Sometimes.
Yeah.
Other times not at all. When she went in, it's almost been 2 years that she's been there.
Yeah.
When I took her there, she knew where she was going, more or less. And her biggest concern was she didn't want me to spend all of my time worrying about her.
Oh.
And she said she's had a great life, but fortunately I've got her 5 minutes from my house, and it's easy for me to just pop in.
That is so loving of her.
It was. It was
that
pretty
was so
amazing.
loving of her.
It was pretty amazing.
One of the things that you did that I have so much respect for is that you created a vacation for yourself, where you
You've helped
could
with that,
you could really unhook.
Yeah.
And you involved everybody in the community that she lives in, and had someone else. And this really isn't about me; it's about you. That you were able to go away with no mental worrying about your mom, and you got to get some rest.
She didn't know I was gone.
No.
It was important. I was 10-hour drive away, so it wasn't like I couldn't get home, but I knew she was being well cared for. I knew that you would call me if there was anything.
Yeah.
But I was able to disengage a little bit, where I wasn't getting all the phone calls or hospice calling just to say she was fine, or just give my mind a rest a bit, because I can't even imagine if I had her at home with me too. It's stressful enough as it is.
Oh, you couldn't do it.
But
That would be so stressful.
But I know a lot of people do.
They do.
And I don't, I have utmost respect.
Yeah, you do what you have to do.
Right.
But one of the hardest things and one of the most necessary things is getting rest.
Yeah.
Mental rest, so that you are really available emotionally,
Yes.
and available, and you gave yourself that.
I didn't even realize how bad I needed it until I was gone.
I know. Then you go and you get that amount
And
of
you
rest.
just feel, it's much better.
So you've hit a new stride with taking care of your mom.
Yeah.
Yeah.
Kind of changes every now and then. You have to be, it's progression.
Yeah.
Things happen. But
Yeah.
yeah, we're moving along.
Well, I'm so glad that you were able to get some rest, get some time away, and that you forged this relationship with your mom.
Well, a lot of it is because of you and the advice you gave me. And it's just, I would just tell people, don't put it off. Have a plan, and then just work at it slowly
Yeah.
as health changes and circumstances change. Because I
Thank
remember
you.
you said to me, something will happen.
Yeah.
Something is going to happen that's going to change everything, and you want to be prepared, and something happened.
Right,
So,
right.
and I was prepared, so that was good.
Well, you did well too. You followed all the advice I gave you, which was really great.
Yeah.
Some people could get the advice and then they get too scared
Yeah.
to actually go in and have the conversation,
Yeah.
pull the information together. But
Yeah, I
you
think
did
even
it.
taking the first steps and finding out what you don't know
Yeah.
is scary to do, because you're admitting that your parents or your loved one is at that point. And that's
That's
kind of
right.
a hard thing to do.
That's right.
And it's hard to have the conversations with them.
Yep, that's right. So you faced the fear of doing it and you did it anyway.
Yeah.
Yeah.
Thank you.
Yeah, you're welcome. Thank you.